A spinal cord stimulator is an implant that's placed on top of the spinal cord to help with patients who have chronic pain in either their arms, their legs, their neck, or their back. Patients who need spinal cord stimulators are patients who have either failed previous surgeries or have had a workup that has not revealed a cause for pain in their neck, their back, their arms, or their legs. So spinal cord stimulators have risks like all surgeries. Specifically for a spinal cord stimulator, there's a risk of bleeding and infection, which is true for any surgery. But specifically, spinal cord stimulators have a risk of damaging the spinal cord because we are implanting a small electrode on top of that spinal cord. That risk includes bleeding, infection, paralysis, weakness, numbness or tingling, bowel or bladder problems, or even death. Although those risks are incredibly rare, in fact, they've never happened in my career, but they can happen to patients. The other risk, specifically for spinal cord stimulators, is the fact that spinal cord stimulators are an electrode that goes on top of the spinal cord, and they try to reduce pain. They most often do, but sometimes patients have psychiatric issues and they don't have complete relief of their pain. So that's why for a spinal cord stimulator, you do have to go through a psychiatric evaluation before they're implanted. It's incredibly rare, but it is a known risk and it's described in the literature. Spinal cord stimulators benefit patients in the fact that it is able to reduce pain where no other procedure, medicine, or intervention is able to reduce their pain, specifically for patients with pain most often caused by neurologic injury, so crush injuries in the leg, previous disc herniation, spinal stenosis that has been relieved with surgery but still has chronic pain. For a spinal cord stimulator, it's a little bit different than most other procedures. First, patients are evaluated for their pain and to determine whether or not they have a pain syndrome that would be well treated with a spinal cord stimulator. Once they've been identified by either a physiatrist, a pain physician, or a neurosurgeon, they're sent for a trial. And the trial is unique in the fact that you get to try out the spinal cord stimulator for about a week before you actually get it implanted. So it's kind of like trying out a car. So what happens is you go and you are seen by a trialing physician, and they do what much like physicians or patients have had before, where they have an injection, but rather than medicine being placed, they actually have a wire that's placed on top of the spinal cord. The wire comes through the skin, and then it's connected to an external battery pack, which you wear around for usually between 3 and 7 days. That procedure then tells us whether or not you're going to do well with the permanent implant. During the workup for a spinal cord stimulator, patients are evaluated, like we talked about earlier, for a psychiatric evaluation to make sure they don't have any of those very rare conditions that would make them fail a spinal cord stimulator. And then once they've gone through these steps, then they're ready for the final implant, which is a surgical implant. Usually what happens then is they've come from the trialing physician, they'll go back to the neurosurgeon who will then discuss the spinal cord stimulator. And then we talk about the surgery that we talked about earlier, where we place the stimulator on top of the spinal cord through a small incision in the back. Again, it's a multi-stage procedure, so there's a little bit of expectations each time. So after the trial, what'll happen is you'll have some pain from the insertion site. It's usually pretty mild, but everybody has a different response. And then after that is removed, you'll go back to the surgeon and you will have a bigger procedure, and it does require general anesthesia. That does result in some back pain. It's usually kind of mid-scapular pain, kind of along the bra line. And that does last about a week to 2 weeks. It can last up to 6 weeks though. And then there is some pain in the back where the battery is implanted. Surgery is a pretty safe and pretty simple surgery, but you do have pain along those incision sites that, like I said, can last about 6 weeks at max, but sometimes a little bit more. It's a muscular pain, it's not a severe pain, and it's usually tolerated well with just some very light narcotics that last no more than about a week or 2 weeks. So most patients should expect at least 50% relief of their pain. In fact, the rules are for most physicians, they won't implant the stimulator unless you've had at least 50% relief. But the vast majority of patients have about 70 to 90% relief of their pain. Now, it's really hard to grade pain in a percentage, and it becomes really kind of difficult. But what we usually try to measure is whether you can do what we call the activities of daily living. So can you do your things around your house? Can you go out Can you go get the mail? Can you go to the store? Can you walk through Walmart for, the whole grocery run without significant pain, or without having to stop or rest or get one of the rolly carts or lean over the carts, or those things that you have to do before the simulator? Candidates for spinal cord stimulators are a lot of different people. So they can have had previous back surgery, previous neck surgery, they could have had previous orthopedic surgery, because there are some rare conditions where an orthopedic surgery can cause significant pain in the arm or the leg. Or they're patients that haven't had surgery, aren't candidates for surgery, or don't have any nerve injury that's still there. So patients who've had stretch injuries, patients who've had burns, amputations, patients who have had even some different kinds of minor surgeries like foot surgery. And now there's actually patients who have neuropathy that are candidates as well. So it can be a huge number of patients with all different kinds of pain in their extremities or their back or their neck. So it really is a lot of different people that kind of fall into a lot of different categories. Anybody who can't undergo anesthesia would not be a good candidate for a spinal cord stimulator. Patients who are on chronic anticoagulation and are not able to come off of anticoagulation, which is a pretty rare subset of patients, but somebody who maybe had a heart attack within the last couple of weeks or months would be a relative contraindication. But otherwise, the main indication that you can't have surgery is if you have severe stenosis in the thoracic or cervical spine, where we're trying to implant the spinal cord. Stenosis means narrowing of the spinal canal. So if you don't have room for the little implant, then you can't have this surgery. That's incredibly rare. I would say 1 out of maybe 100 or 200,000 patients, if even that. We always check every patient before we implant that, but theoretically, if you didn't have room, we could implant that. But again, very uncommon, and something that you wouldn't know as a patient. You'd have to be kind of evaluated for that. For most companies, there are 2 different kind of batteries, as they say. The medical term is a pulse generator. The idea is that the spinal cord stimulator is giving an implant or an impulse to the spinal cord, and they're at very, very high frequencies. In other words, they're happening several times a second. In fact, they can happen several 100,000 times a second for some different kinds of stimulators. And so that requires energy. And so it does require an energy source, and it's a battery that is along the battery pack that's usually in the flank. So that battery pack can be various sizes. They can be a couple inches long, or they can be about 6 inches long, and they can be 2 millimeters thick, or they can be about 3 inches thick. And it just depends on the implant company and the different battery type. So for a rechargeable battery, it's almost universally smaller because you can recharge it, and you recharge it much like you would if you put your phone on a charging pad. It's important to see a specialist for a spinal cord stimulator is mostly because specialists are the ones who determine whether or not you would be a good candidate for that. It does take a lot of experience to really kind of identify patients who would do well and who don't do well. And when spinal cord stimulators first came out decades ago, they were kind of the hot new thing, and a lot of people got implanted with them that weren't good candidates. And patients that aren't good candidates for something don't do well with that, and that's pretty obvious. And so that's why we've kind of created these rules and these trials to make sure that we identify patients that will do well, because we don't want to do surgery on you if it's not going to do well for you. So we go through kind of with our experience and with all the knowledge of how stimulators work and how your pain works, and whether or not your pain is neuropathic pain or not, and whether or not you would do well with the simulator. It really benefits to be seen by somebody who does do simulators. There are a few studies out there that show that have patients who have seen surgeons, specifically neurosurgeons, that do stimulators are usually implanted earlier, which means they have a better outcome, because we know that quicker you have an implant, especially after an injury, the better off you do, because you're able to break that pain cycle, which helps prevent kind of long-term chronic pain. So in general, we do recommend that if you do have chronic pain, even if it's been a long time, you want to get implanted sooner than later if you are a good candidate. So you can have a spinal cord stimulator removed. It is kind of reverse of the placement of the simulator. So we kind of go in the exact reverse. So we put the battery pack in last when we place a simulator. So to take the simulator out, you take the battery pack out, you remove the wires, and then you go and reopen that incision in the mid-thoracic spine, so kind of the mid-chest area on the back, to remove that simulator. It's relatively easy to do. It takes probably about 30 to 45 minutes for most patients. It can take a little bit longer depending on scar tissue, but it is usually relatively easy to do. It's a very simple surgery. It does have risks, but the risks are, again, very, very, very small, and it's a very pretty safe and short procedure if it needs to be done, although we don't have to do it very often. To place a spinal cord stimulator, you do have to do a surgery, and it is called a laminectomy, although it's a very small laminectomy, so it's a limited laminectomy. So what we do is we make an incision in the mid-thoracic spine, and we use your trial data and the pictures from your trial to know exactly where to place this. We do move the muscle off the bone, so we use what's called bovicautery, which is electricity, to kind of move the muscle off the bone to free that up from the bone. It will reattach to the bone after surgery pretty quickly, and then we open up a very small incision into the bone using what are instruments that bite the bone. It's very small. It's even hard to see on CAT scan because it is so small, but that allows us to directly visualize that stimulator being placed on top of the spinal cord, which makes it much safer and much easier for the patient. The other thing is we anchor it to the bone, which means that it won't move. It doesn't hurt to do that. You don't feel it. There's little silicone pieces of anchors that go on top of the bone that are anchored to the bone to hold those wires in place. And then we tunnel underneath the skin to the battery pack, which sits in the flank, usually the right or the left flank. It really depends on the patient's usually handedness to know which side to put it in. You don't feel that because it's in the small of your back. And when you're sitting down, you don't sit on the small of your back, and you don't feel it when you're laying down because you don't lay on the small of your back either because of the curvature in your back. So it's in a place that really doesn't feel, there's no bone there, so it's pretty easy. Again, the surgery takes about an hour and a half, so it's pretty easy, but to remove that bone is a very simple process that every spine surgery you have to do, and it's pretty safe to do.